Let's go ahead. Today I am here not to speak but to listen to my teacher and mentor, Dr. Milind Patil. And it gives me pleasure to introduce him and talk about him. The way he conducts his lecture, it's absolutely amazing and you will have that good experience. So a little background of Dr. Milind Patil. Dr. Milind Patil is senior pharmaceutical physician and academician. Currently, he is working in medical marketing consultant for Millennium Life Science, Mumbai. In past, he has worked with well-known Ayurveda pharma company like Dudh Papeshwar, Themis, Copran, Raptox, and Charak Pharma Private Limited. Beside his medico marketing experience, Dr. Patil has extensive teaching love. The style and substance of his creative contribution have distinguished him from his peers in dealing with today's burning healthcare issues. Dr. Patil is always ready to teach and interact with students as well as professionals in friendly and spontaneous manner. He has made scholarly and thought-provoking presentation on reputed platform, and today he will be sharing such a interesting thought-provoking session for all of us. So once again, welcome Dr. Milind Patil on AYG Academy platform, which literally promote all these Indian science, that is Ayurved, Yoga and Garbhasanskar. So I welcome all along with our special speaker, Dr. Milind Patil. So sir, now platform is yours and I'm giving you this access to you if you can share your screen and start your session. Thank you so much.
Namaskar to all of you. Thank you, Dr. Nutan, for that kind introduction. Today we will talk about, I will share some of my concepts about what is happening to Ayurveda. We are all aware, doctors, that Corona has made us understand. Corona has made the world understand the importance of Ayurveda. And that's why we should be very thankful, not to the Corona, but to the times that we are in the limelight. I always start my presentations with expression my gratitude and obedience to my teacher, Dr. Vasudevji Vyas. He did teach me right from my undergraduate years to, am I audible?
Yes, sir. Yes, sir.
Okay. So right from my undergraduate years to my postgraduate years, and as my colleague in the department of Samhita department, he always told me that Milind, just have complete faith in Ayurveda so that in future, when Ayurveda becomes the global medicine, universal medicine, not the alternative kind of thing, but the mainstream medicine, you will remember my words. And today, I certainly do remember what he used to tell us in our colleges. And when I talk about this, he was a genius par excellence. He was a rishi in kind and substance. Okay, and look at his face, just like a rishi, sattvic, absolutely apta nature, and that's how we did believe each and every word of him, and that is what we are witnessing today, that each word of Vedavyaji about the future of Ayurveda is true today. Just see this quotation, my friends. This is some mathematician. Mathematicians are rishis par excellence. Okay, what does he say? What did he say in 1947? In these days of conflict between ancient and modern studies, there must surely be something to be said about a study which did not begin with Pythagoras and will not end with Einstein, but is the oldest and youngest of all. I will read this sentence again. When Vyasji did tell us about Ayurveda, that Ayurveda is Anadi.
Sir, just a little blurred sound is coming. Can you just come closer to the mic? Yeah, sorry to interrupt.
Is it clear now? Yeah. So I will read this sentence again. Am I okay, Nutan? Yeah, thank you. I will read this sentence again. This is some mathematician. Mathematicians are scientists par excellence. He did say in 1947, I read, in these days of conflict between ancient and modern studies, there must surely be something to be said about a study which did not begin with Pythagoras and will not end with Einstein, but is the oldest and youngest of all. This is what Vedyavyasji used to teach us in our college days when we were doing MD, postgraduate studies with him. Okay, Ayurveda is Anadi, that is beginningless. Ayurveda is Ananta, that is endless. And that's why Ayurveda will remain relevant in all times, eternally. Okay, and that is what we experienced during these Corona days. And that is the occasion that I'm speaking on a topic, Ayurveda for healthy progeny. Friends, during this era and future eras, we will have generations, we will have nuclear couples, we will have couples which will go for healthy progeny because they will go for only one or two children. And if they are going for one child, and then they will really expect that their offspring is very healthy as far as modern standards go. And that is what is mentioned in Charak Samhita. What does that Sanskrit line say? Stri punsayoho avyapanna shukra shonita garbhashayoho shreyasim prajam ichhatoho tad abhinivrutti karam karma upadekshamaha. Charak says that those would-be parents, male and female, with normal semen, normal sperm, normal ovum, normal garbhashay, that is uterus, and when they desire for shreyasim prajam, English translation of shreyasim prajam is healthy progeny. We are explaining the karma, we are explaining the means, we are explaining the treatment for these couples so that they give birth to a very healthy progeny. Shreyasim prajam, that is what the Sanskrit word is used by Charakacharya. So this shloka talks about the importance of Shreyasim prajam, healthy progeny, and the do's and don'ts that are advised in Ayurveda. I certainly cannot cover all the points in this 20-30 minutes, but then I will really take you through a very, very basic parameters and the theory, modern theory, how does it affect? And here, the Sanskrit is well explained in the term epigenetic reprogramming for healthy progeny. So whatever do's and don'ts we Ayurvedic people prescribe for healthy progeny, they do some kind of reprogramming in the sperm, in the ovum. These reprogramming techniques are called not genetic, but epigenetic, beyond DNA, etc., above DNA things. And that reprogramming is very specifically described in all books of Ayurveda, be it Charak, Shushruta, Vagbhat, etc. So we should always remember that Ayurveda has the most important role to play in healthy progeny. And I'll take you through some of the theories so that you understand even on modern lines. We go. See, this is infertility. Just look at that picture. The couple is infertile. Either male is suffering from unexplained infertility or female is suffering from. It's a great, huge burden on the mind. It is a great, huge burden on the hypothalamus. And because of that stress, because of that pressure, emotional pressure on the hypothalamus, the hormonal communication from hypothalamus to ovaries or hormonal communication from hypothalamus to testis is disturbed, and therefore infertility results. We will talk today about male infertility only. I'll just make you understand what exactly is happening in modern sciences, which is just talking about ancient Ayurvedic concepts. Did I use that word ancient? I should not use that ancient word again. Okay, it is ever modern Ayurvedic concept. That's how we should go. So when we talk about something called as epigenetic reprogramming for healthy progeny or for treatment of male infertility or female infertility, we should talk about this epigenetic reprogramming as the mainstay. Just see, my failure at becoming a father, he is depressed. The whole thing goes like, ate away at my very being. And that is what hypothalamus suffers. And therefore, whatever treatment, whatever molecules, whatever herbal medicines, whatever do's and don'ts, we Ayurvedic Vedas prescribe to this person do not only work at the testosterone level or testicular level or ovulation level, but they mainly affect the hypothalamus. They mainly affect the adaptogenic activity of the body. And that's how the person becomes really, really willing to give birth to a child. So this guilt feeling, my failure at fatherhood, ate away at my very essence. Because what is the essence of a human being? Or for that matter, any living being? It is giving birth to the next generation. And when that's not happening, the hypothalamus is disturbed, and communication between the hypothalamus and all organs responsible for reproduction are affected. And that's why we need to understand what do we do. The uncertainty and then growing expectation of exerts a great pressure on our married life. And therefore, look at this infertile person. He is looking at that infertile, not very fertile, not very potent sperm. So what do we do to give a very potent sperm, very active sperm, a good number of sperms that we will describe? So one of the defined etiologies for male infertility is the excessive generation of reactive oxygen species by abnormal spermatozoa. What do we see here in the picture? I may not talk much about the technical details, but see the parts of the sperm. This is the acrosome. This encloses the genetic material in it. In simple language, you can call it as head of the sperm. Then there is a midpiece. Look at the name mitochondria. This midpiece of the sperm is fully saturated with the mitochondria. Mitochondria, a simple science, it gives energy to the sperm and it has a long tail. Now just imagine, my friends, if this single sperm has to reach the ovum in the fallopian tube of the woman, it has to travel from the testis, whole male reproductive pathway, then vagina, then uterine cavity, and then it mates and impregnates the ovum, which becomes zygote, and it develops into fetus. Look at the sperm again. It has three parts: head, which encloses the genetic material. Then it has the neck, mid-piece portion, which is full of mitochondria. Mitochondria are the powerhouses of the cells, and they will make energy available for the sperm, so that with the help of the tail, the sperm moves from testis to the fallopian tubes. Just imagine millions and millions of sperms traveling from male testis to the fallopian tubes. So if few sperms are abnormal, they will generate reactive oxygen species. Again, a thoda scientific term, But then we will not go into understanding what that science is. I will show you a picture. Just see. Look at this welding process going on. Look at the process, and there is a huge generation of sparks. And what is happening there? Two metal pieces are being joined by heat. Very same thing happens when sperms are generated in the testis. Millions and millions of sperms are generated. There is highest kind of metabolic activity going on within the testis, and this metabolic activity is responsible for generation of the sparks, which is called as oxidative stress. Testes are lying outside the human body. They are not within the abdomen. Why? Because they are hanging outside the body, this oxidative stress is reduced. So oxidative stress is a condition in which the production of oxidants and free radicals exceeds the body's ability to defend itself. So how do we, during the welding process, how do we protect ourselves from the sparks? See, they are using special kind of gloves. The welders are using special kind of aprons. They are using goggles. Okay, so that their skin, their eyes, their face, their body is not damaged by the free radicals or sparks which are generated during the welding process. Very same thing happens, my friends, in the testis when sperms are being produced. Okay, and if this spark falls on the sperm, it will become defective, or it will die. Sperm count will die, or the sperm production will stop, and the person will have less count of sperms, or abnormal sperms, or less motile sperms. So what do we recommend to reduce the sparks? We do recommend medicines like amalaki, like gokshur, like ashwagandha, which are potent antioxidant medicines. And these antioxidant medicines will take care of oxidative stress. They not only take care of oxidative stress, they will be responsible for stimulating the hypothalamus. They will be responsible for producing the testosterone. They will all be responsible for stimulating the spermatogenesis. And that is what the epigenetic reprogramming is. And this is how we get healthy progeny. So friends, never forget that for healthy sperm, you need to control oxidative stress, because high free radical levels in this are present in infertile men. They reduce sperm motility, they increase sperm DNA damage, they lead to cell membrane lipid disorientation, and they will also lead to defective oocyte sperm fusion. Just try to understand, excessive amount of metabolic activity goes on during the sperm formation. Millions and millions of sperms are being produced in the testis. This reproduction requires high states of energy levels. High states of metabolic activity certainly leads to huge oxidative stress, excessive generation of reactive oxygen species. In simple language, we will call that excessive generation of sparks. And if you don't have gloves, you don't have goggles, and you don't have good quality apron, then this person will get damaged. And this is what happens to the sperm. So the sperm will not move properly. There will be sperm DNA damage. Sperm cell membrane lipid will be damaged. And ultimately, if the sperm finds the oocyte, ovum, female seed, and tries to embrace it, that embracement, that alingan, that fusion will be defective. So we have one special branch of Ayurveda, and that is called as Vajikara. Okay. You'll be surprised to know that Ayurveda was once upon classified into 8 branches. And the one branch was called as Vajikaran, which was there to give you solutions for healthy progeny. Now, when I have an infertile patient in front of me, I want sperm count, but then the latest research suggests that counting sperm does not add up anymore. So there is a time for new equation. So what should we be counting? If not sperm count, we should be counting the excessive free radicals. Okay, what happens to the oxidative stress? And just understand, my friends, from this simple example of welding, oxidative stress is something similar to excessive fire. As if the building is on fire, the testis is on fire, and that fire will burn the sperm. Why the fire is damaging the sperm? Because sperm by nature is cool, water-like, ice-like, and therefore excessive free radicals are responsible for damaging the whole process. I won't go into the Sanskrit elaboration of these, but then these 2 Sanskrit lines simply explain that sperm semen is very cool, sperm semen is very mild, and therefore one should always protect the sperm or semen from the fire, free radicals. That is what and then only sperm will be effective in. So we always translate Vajikaran as aphrodisiac, but then it is not the aphrodisiac property of Vajikaran. Aphrodisiac property of Vajikaran Dravas is side benefit of the Vajikaran medicine. Effect of Vajikaran Dravas is Bija Poshana, because that is how is explained by Vagbhat, that Vajikaran chapters describes the medicine which nourish sperms, which improve spermatogenesis. And side benefit of Vajikaran medicine is aphrodisiac. They act as sex tonics as well. Why? Because just see article published in Times of India, 23rd March 2009. What does it say? The heading says, want to conceive? Try wild energetic sex. When Ayurvedic doctor, Ayurvedic scholar looks at this heading, he is surprised. Want to conceive? Try wild energetic sex. And the whole article talks about importance of Vajikaran medicine in the treatment of infertility. So fully stimulated men enjoying intercourse ejaculate up to 50% more sperm, say researchers. And that is what the modern explanation of Vajikaran medicines. So men enjoying intercourse ejaculate up to 50% more sperm. Changes going on in our body also help to pull or suck up the sperm into a cervix. Don't forget the publication date 2009. And the latest research adds further light on the mode of action of. I will end my presentation with that. So till that point, you will remember that for conception, the couple has to enjoy wild energetic sex. Wild energetic sex will make woman suck up the sperm into a cervix, and there are high chances of conception. Look at this slide again. Then this Sanskrit Vajikaran Nityahasar Icchan Kama Sukhani Cho Upabhoga Sukhan Siddhan Virya Apatti Vivardhanan is nothing but Sanskrit interpretation of this news item. Complete Sanskrit says that if you want to conceive, try wild energetic sex. So when my master, when my Guruji, when my teacher with the Vyas told, just have faith, in what Ayurveda says. It is ancient, Anadi, beginningless science, and in future you will certainly see that even modern science will accept the rationale of Ayurvedic medicine, and this is what is happening. And Corona has made us understand the rationale completely. So, if one wants to conceive, try wild, energetic sex. Okay, horse does represent power. Okay, we do measure power as a horsepower, and Vaji in Vajikaran is horse, and therefore the name itself, the name of the Ayurved branch, Vajikaran itself, talks about the importance of energy, the importance of movement, the importance of motility of the sperm, and therefore that energetic sex is important, which is healthy, good for healthy progeny. Just think of this imbalance in hypothalamus pituitary gonadal axis. Stress will affect the hypothalamus. Stress of being infertile itself will affect the hypothalamus. Then smoking, steroids, etc., certain drugs will really disturb the spermatogenesis. And this imbalance in hypothalamus, pituitary, gonadal axis will result in excessive generation of free radicals. And that is where Ayurvedic medicines will work. Just look at the heading, a look toward the future. Advances in andrology expected to revolutionize the diagnosis and treatment of infertile treatment. It is hoped that the advanced techniques and research findings discussed will provide not only new treatment options, but also insights into the safety and long-term consequences of the predominant current clinical strategy, which largely relies upon the use of defective or deficient sperm for fertilization. And you don't really treat the cause. So we will have to treat the cause, that of excessive free radicals. And then only we'll be able to make this sperm travel very fast and meet the ovum and fertilize it. This done properly will result in healthy progeny. Just try to understand, my friends. Life has to undergo a kind of stress, a kind of optimum stress, so that the living principle, the lively animal competes in the future. Okay, if we make that sperm compete with other sperms, it will result into healthy progeny, and that's how we have to have Vajikaran, karma, Vajikaran as the first preference for healthy progeny. And that is what this line says, that male and female with not very abnormal sperm, menstruation is okay, garbhasaya is proper, uterus is proper, and if they want Shreyasim Prajam, healthy progeny, then they should go for Vajikaran therapy. What will be the result? It will really nourish and make it more powerful. Apatya Santanakaram, and healthy progeny, healthy semen will be the result of Vajikaran medicines. Just see this slide. This is published in, I understand, that was in 2009. This was in 2019 or so. Just try to understand science news. Sex and the female brain. Protein in semen acts on female brain to prompt ovulation. The better the sex, the better the chances of conception. So if the person, the couple desires for healthy progeny, they should go for Vajikaran therapy of Ayurveda, because that wild sex will affect the female brain, and a particular protein in the semen will act on the female brain and the female brain will prompt the ovulation. So there are more chances of fertility. There are more chances of conception. The better the sex, the better the chances of conception. So those who are very, very familiar with Ayurvedic text, those who are experts in Ayurveda, Sanskrit, and the textbooks of Ayurveda like Charak Sushrutu Akbat, and those who are also aware of what is happening in modern medicine, they will really feel that yes, the Ayurvedic medicine is relevant for all the time to come. And therefore, for healthy progeny, Ayurveda is the only solution that we must take to the heart. Just read the science news. The better the sex, the better the chances of conception, because a particular protein in the semen acts on the female brain to prompt ovulation. So Vajikaran medicine is not only sex tonic, is not only aphrodisiac, it does have a beneficial effect on female brain, and this beneficial effect on female brain will result in prompt ovulation. This kind of understanding of our Vajikaran therapy must be kept into mind. Just see, a person is smoking, that is generation 1, and she will pass on these ill effects to the second generation, and this second generation will not be able to produce ovum. So a woman who smokes while pregnant induces epigenetic changes in 3 generations at once, in herself, her unborn daughter, and her daughter's reproductive cells. I will read the sentence, little modification. A woman who has taken the therapy from the Ayurvedic Vaidya for healthy progeny induces epidemic changes in 3 generations at once in herself. She herself will become healthy and fertile, her unborn daughter, and her daughter's reproductive cells. So that the moment couple undergoes Ayurvedic therapy for healthy progeny, that Ayurvedic therapy for healthy progeny and 1 generation will affect the fertility in a better way of the next 2-3 generations. And this is what the potential of Ayurvedic medicine in treatment. I will read this. A woman or a couple who goes for healthy progeny measures described in Ayurveda induces epigenetic changes in 3 generations at once. In herself, she herself will become healthy, her unborn daughter or unborn son, and her daughters or granddaughters' reproductive cells. Therefore, a couple undergoing Ayurvedic therapy for healthy progeny will pass on these good beneficial effects to the future generations. So you have generations of healthy progeny that can only be done by Ayurvedic way. This message we should take. And this is the epigenetic modulation. So whatever treatment that we Ayurvedic people recommend to the infertile couple are epigenetic modulation. And all those medicines which we do recommend for the healthy sperm do modulate epigenesis, and that's how it will have beneficial effect, and the couple will be able to give birth to healthy progeny. Thank you, friends. I will make the next presentation, Dr. Nutan, maybe will be a description of quite a number of do's and don'ts for healthy progeny. This is the basis. This is the fundamentals of Ayurveda, and all these fundamentals are being validated by, authenticated by modern today's science. And therefore, we should always place the immense faith, Shraddha, in whatever is written in our Ayurvedic books. Next module or next session will cover particular do's and don'ts for epigenetic modulation in the reproductive system of the couple, so that there is a result of healthy progeny. Not only the next healthy progeny, but then generations to come will be healthy because of this treatment. Thank you very much.
Thank you, sir. Just can you just take out this slide,
Which slide?
your slides, so that we can have interaction.
And stop sharing.
Yeah, stop sharing. So thank you so much, Dr. Milind Patil, for giving us insight. Our next session, that is part 2, will be there on 11th December, same time, 6 p.m. and on Sunday. So we will be discussing on tips and the suggestion for how you can go ahead with healthy food.
I'm planning to give specific recommendations for the couple, so that healthy progeny is the result.
Okay. So we want all those who are interested to know about all those tips on 11th December, right? Yeah. So, sir, I still see your slides on screen. I don't know. Just stop share. Is there any question? Because in our audience, I can see there are many great yoga teacher, and also, Rajiv Gupta ji from UK also here, sir. Nice to see you here. Neha Sharma ji here from UK. So we would like to have some interaction with great participants present here. Sir, still we can see your slide. I don't know how you can stop. Okay, now we are. Yes. So,
Namaskar,
yes,
Dr. Gupta ji.
Yes.
Namaskar. It's so nice to hear good work that has been done and your presentation in a passionate way, which just puts the Ayurveda into a bigger perspective. Most of people in UK haven't yet identified the value, and we are trying to bring the integration of the modern medicine with the traditional medicine. So hopefully a lot of work has gone in and we are going to move forward. So thank you all of your group to really do that great work and present to us.
Thank you, sir. Thank you for those kind words. And as far as I am concerned, I am very much confident that integration is the way forward for promotion of Ayurveda the world over.
Yeah. I mean, I'm thinking is that it's really good to see. I don't know, it's a bit early to say, but the checking the IQ of those who have gone a proper Garbhasan, and I think that's what Nutan does, versus those who have not gone, and what has been difference in their EQ, which is the emotional intelligence, difference in the IQ, in the performance, and that will give us a little bit more tangible figures.
Right.
I'll be very keen on it.
Thank you, sir.
Yes, sir. Sir, I have question. If participants do not want to ask anything, so I have question, because I always find opportunity how I can learn from my senior teacher and person like you, Dr. Milind Patil. You are my inspiration all the time. So there is a concept in Ayurveda that is Atulya Gotra Adhyay. So would you like to say something about it, how it relates with our healthy project?
I think, Dr. Nutan, I think you are the expert in this field.
Sir, but here today I called you as a speaker, so I want to be student now. So I just want.
Okay, because different sets of, see, if you have a Tulya Gotra marriage, okay, and if there are abnormalities, genetic abnormalities in both in the streams, male and female, they will add on to the whole thing, and therefore Atulya Gotra is described. In fact, the chapter name itself is Atulya Gotra. The first word goes like this: Atulya Gotra. That Gotra should not be from the same thing. Okay.
So unhealthy progeny, if you really want to plan this healthy progeny ahead, so you should not marry first of all in your nearby relation. Right. So it starts from that counseling couple.
Because genetic pool comes from the same.
Okay. Okay, fine. Thank you, sir. Is there any question? Here we have even Dr. Neha Sharma from UK. So, Dr. Neha, would you like to ask anything regarding any research you come across? in this particular topic. If you are available there, you can speak to us.
Yes, yes, I am here, and I've been hearing a wonderful presentation shared by Dr. Patil. I don't have question, but this is really interesting and fascinating how he, connected the dots. Just a question, more like a curiosity. If I may ask, we know that do's and don'ts and prevention, what uh, Dr. Patil shared. But is there a way, if it cannot be prevented, is there any cure for these consequences during conception? And if these things haven't met, but then there is some consequences in child or in the pregnancy, like high risk pregnancy. So how we make sure that we manage afterwards? Is there a way to deal with these consequences like genetic disorders or even the behavioral disorders, which we suspect now with these complications? I'm not sure if I made my question clear.
Yeah, I think, ma'am, I understood your question. But
yes,
in Ayurvedic text, Garbhavakranti is the chapter given in our Charak Shushut Vagbat, and that Garbhavakranti will describe complete do's and don'ts, so that not only genetic, but then even lifestyle disorders and etc. will not occur in the healthy progeny. See, the whole thing boils down to one thing. If we do take care of the metabolism of the healthy progeny into consideration, so all these therapies that are described in Ayurveda will make sure that the Dhatvagni part of the progeny will be taken care of. And when I talk about the Dhatvagni, I mean the complete biochemistry, complete biometabolism is affected by preparing the would-be adult right from the uterine stage. And when I look back at my Sanskrit text, I do feel that we do have this word itself, epigenetic, is quite a new word in modern medicine. Okay, so the therapies that we recommend for healthy progeny do have epigenetic effects on the growing zygote or the growing fetus. And that will help us prevent psychological, metabolic, and genetic disorders in the progeny. That's for sure. Maybe if time permits, next time I'll give little bit of whatever modern research has gone into description of this phenomena.
This is wonderful to know, because I know in the conventional system, including the psychotherapy, counseling to whatnot, we try to integrate, but the outcome is not as promising as what you just shared. So just little background of something I had in mind, and I've been working for years into the area. As you said, the woman's mind, and of course, throughout pregnancy, we understand what she thinks, what she perceives, and what she's going through emotionally, mentally, does directly affect the child. So this is everywhere we know, and it's a confirmation by the scientific evidences. So I work a lot with the abusive and violent situation, high risk pregnancy, where the family environment is not very healthy, relationship to intimate partner violence, and this all increases during pregnancy. Now, in the conventional system, we don't have much. Even the psychotherapies approaches has not worked. And this generation, actually, statistically, they are more prone to mental health disorders. And we have seen even the early childhood, we describe them as a DV child. So this is a classic behavioral changes. We see them right from the birth onward. Now, in Ayurveda, if I say when the circumstances to lifestyle, and there is nothing else but the environmental factors like this, which are not in control, can we still help mother and child to make sure that we can prevent the future consequences for the child and of course mother in the postnatal as well? So is there something we can integrate? And because I work very predominantly in UK and India, especially in these situations, I would love to see integrate what we can do best to make sure we have healthy progeny. At least we can prevent the future consequences for the children.
I think we need to be very optimistic in this regard, and I will just share one experience with you.
Sure.
Some pregnant colleague came to me and she said that, sir, I conceived 4 months back. Is there anything that I can do Ayurvedic way so that I have a good, healthy child? Okay, and she was quite skeptical about taking Ayurvedic medicines. For her gynecologist and doctor has said that you will not take Ayurvedic medicines. So I told her, don't do anything. I don't want you to take Ayurvedic medicine, but if at all you will do some kind of activity before you go to bed, count 1 to 100, not mechanically. Just say to yourself, 1 plus 1 is 2, 2 plus 1 is 3, 3 plus 1 is 4, 4 plus 1 is 5, something like that till 100. And then go on reducing. 100 minus 1 is 99, 99 minus 1 is 98, 98 minus 1 is... So don't be mechanical 1, 2, 3, 4, 5, 6, 7, 8. Instruct the child in the uterus that 1 plus 1 is 2, 100 minus 1 is 99. Mathematics is only addition and subtraction. And as this person was little bit exposed to science, she was a pharma graduate, I Googled and I saw a clinical trial that those women who did this kind of exercise during pregnancy gave birth to mathematically intelligent children. Okay, that is how the conclusion is. Okay, so
Wow.
mother's thinking, even mother's positive thinking, will have a beneficial effect on the mind of the growing fetus. Okay, maybe next time when I speak, I will share that report with you all. And this was quite simple
really
thing, 1 plus 1.
Yes.
And I told her, don't do it mechanically. Just make sure that 3 plus 1 is 4. That's how your growing child in the uterus will understand and try to understand the mathematics.
Yes, yes.
Okay.
Very doable and very simple. Thank you. Thank you for sharing.
Okay.
Look forward to hear you next.
Thank you, ma'am. Thank you very much.
Thank you.
Dr. Rajiv would like to say something, I guess.
Yeah, I think again there is a question that came to mind. Can you hear me?
Yeah.
Fantastic. Is there any study that we have done or can do the effect of Garbhasan yoga or any of these natural ways onto the birth weight and the milestones in the first year of life or at the most first 2 years of life, because that's extremely useful and is a good predictor of the future performance. And while there is now more consciousness about how we should live, the number of progeny is limited, we have less children, we think a lot about before producing children, before doing marriage, before having relationship, and during pregnancy as well. As you know, previously the ladies were working, cooking, lifting, and working in the farmhouse and whatever, and then they will have labor pain and deliver. There's a lot more attention being paid now, and now the elite population is paying even more attention. It will be useful to find if we show the impact of that attention and that extra care and all these natural ways that we are incorporating into it. And that will motivate more people to adopt it. And that's the other way to integrate, because I'm very keen on integration, as you know, and I love to work with you on that aspect. But this is what sprung to my mind, that if we can do that, and that's a simple thing, it's an easy thing, is doable, and it doesn't need any more resources. So I would just love to know your views.
Oh, yeah. I think we can do all this. Even yoga and meditation practice during pregnancy will certainly help take care of not only growth and development, but also on behavioral patterns.
And
particularly,
yeah. So I just want to say, particularly now there is more ADHD or attention deficit disorder, more autism, and we don't know these behavior problems which occur and are causing
right.
To be addressed.
That's really wonderful discussion we had. Never thought of having you, Dr. Rajiv Guptaji and Nehaji here, but I'm glad that you are here. Yes, Shilpa, you want to ask?
No, I don't want to ask, Doctor. I mean, this subject is too very heavy for me to understand, but I'm trying to learn many things here. But I really liked two concepts here. I have learned two new things here. We just casually say smoking is not good for women, especially, also for men. But here, Dr. Milind has elaborated it so nicely in one sentence, like, a woman who smokes while pregnant induces epigenetic changes in 3 generations, which is something new that we learned today. I mean, it's really, really interesting to know this concept. And the second concept, which doctor highlighted here, was the better the sex, better the chances of conception, which again, we casually say it, but we never knew the depth of or maybe seriousness of that concept. So Dr. Milind Patil, thank you very much for highlighting these two things I really loved.
Thank you.
So that's the end of this session, I guess. Thank you. That's really good habit that I feel like my student always will try to listen, okay, what's new they have learned, because that's what I always, tell them as a assignments during, teaching this prenatal, postnatal yoga and Garbhasanskar. So thanks, Shilpa, taking this point. And thank you, Dr. Milind and everyone here for making this session so interesting. And this video recording is available on AYG Academy. If you have missed earlier talk, what Dr. Milind was sharing, so it is available on that link. So I will share with you all so that you can listen again and revise this. So see you soon next Sunday again with new expert. And we will be meeting again Dr. Milind Patil on 11th December. So keep keep your track and don't miss this date and time. Thank you so much. Have a nice day ahead. Bye-bye. See you.
Bye, Doctor.